Hey guys, Gretchen Zablocki for your Wellness Wednesday. We are back at Dr. Harris's office. We're wanting to talk to you a little bit today more about treatment options, some of the new technology that's available for pain medicine. Last time we talked a little bit about what the difference was between a general pain clinic and then what you offer. So what are some of the new things coming down the road, some of the things that you offer here that makes you different?
Well, we have a lot of techniques, a lot of new technology. I want to follow up our last video just briefly.
Yeah.
I think one of the most important things from that video is one of the most important things, the message we can get out to the other physicians in the community, and that is the best time for us to evaluate someone is actually before they ever start on pain medicine or when they're on very low dose and it doesn't seem to be working. We should be working with that patient to see if there are other options. Unfortunately, we get a lot of patients after they've been on pain medicine a long time, and then some of these things can still be very helpful.
Yeah.
But let me show you a few of the things. First of all, let's talk a little bit about stimulation.
Okay.
Stimulation has been around since earliest recorded history. I mean, that's one of the oldest tricks in medicine. Whether that's with the needle or any type of stimulation can cause people to activate their natural pain relieving mechanisms and can slow down or stop pain entirely in some people. So there's a variety of things. Most people are familiar with the TENS unit, where you stick the patches, and that has an effect for about half the people. It's mild to moderate, something that I've done for about 30 years now. I think it'll be 30 years this year, and that's spinal cord stimulation.
Okay.
And this is the lead. Two of these are put in the epidural space, and they stimulate the back of the spinal cord, so the patient will feel the stimulation in the low back and going down the legs.
Okay.
Or these are actually also placed in the neck, again in the epidural space close to the spine. So these little 8 electrodes, when they are activated, will stimulate the back of the spinal cord. The brain thinks that stimulation is if it's in the neck, coming from the shoulders and the arms.
Right.
And it tries to turn the volume down. And when it does that, it can be very effective at blocking pain. So that is something that we do routinely.
Now let me ask you, how long does that last?
These can be in for a lifetime.
Okay.
And I have patients, having done them 30 years, I'm still seeing some patients that were in that first group. I have patients that have stimulators for 30 years now.
Okay.
The technology has greatly improved. There used to be large boxes put under the skin. At one time they were external, sending waves through the skin.
Yeah.
And then they had large boxes with a battery, and now the current box is about this size.
Yes, that's much. My sister has one, and that's a lot smaller than hers.
Yeah. So this is these wires are put under the skin and go into this.
Okay.
The patient has a handheld controller.
Okay.
Now that's not new technology, but that's still a very useful tool.
Yeah.
For people with chronic severe pain.
Yeah.
Now a much more recent advance, and one that I'm excited about, is peripheral nerve stimulation.
Okay.
Now, I've done peripheral nerve stimulation for over 20 years, and for years we used this type of lead and tried to put it near a nerve to stimulate a nerve, but it would move. There was nothing to hold it there.
Yeah.
And so now they've come out with this new technology. This is all it is, and this is put under the skin. And if you can see, there's a little anchor right there.
Yeah.
And once it's put next to a nerve, this holds it. You could, if you pull hard enough, it'll come out. So it's not metal anchors, it's just silicone anchors. But that will go under the skin. Say if someone has a damaged nerve or pain in their arm, it can go under the skin. And then once this is all under and this is close to the nerve, they wear a patch like this when they want to stimulate. And they have a controller that they can set it, and so they can stimulate for an hour and sometimes take this on for 10 or 12 hours.
Okay.
Some people only need to stimulate once or twice a day.
Okay.
Some people stimulate several times a day, but they give themselves breaks.
Yeah.
So this can stimulate for chest wall pain, shoulder pain, anything in the upper or lower extremities.
Yeah.
Pain from hernia surgery that the pain never went away. That's a great application for this. But this is so new that there is actually we'll be the only center putting this device in. I think there's one doctor in Nashville.
Okay.
So this is very new technology. Wow. We're ready to start putting these
That's
in now.
awesome, yes.
So I'm excited about that, and the results on that are very good.
Great.
For a specific purpose. Again,
Yes.
just like the spinal cord stimulator, that's not for everyone.
Yeah.
For people that have a severe nerve pain problem, this can be the most powerful treatment right now that we have.
Yeah. Now I know there's been, we talked a lot about getting in here for an evaluation to find out exactly where the cause of the pain's coming from. Just a general sciatic nerve diagnosis isn't very helpful to you, but people with sciatic nerve issues and other things like that, are there other treatment options, procedures, things that you have available for those type of patients?
Absolutely. And again, sciatic nerve, generally speaking, that is a problem that originates in the lumbar spine, where nerves are being irritated. Sometimes it's not a nerve problem at all, but they're given that diagnosis. Sometimes it actually can be an injured sciatic nerve, and this little device can actually be put on a sciatic nerve.
Right.
Then there are, if it's a chronic nerve root problem, this spinal cord stimulator is very good for people who've had low back surgery and have that pain, low back, hips, and going down the back of the legs, which is called sciatica or sciatic nerve pain.
Okay.
But again, what I try to do always is get a diagnosis that's as accurate as I possibly can.
Right.
And sometimes people say it's a nerve going to my foot. Well, it may be referred pain. It may actually be arthritis of a small joint.
Yeah.
And that's one of the other technologies that I wanted to discuss.
Yeah.
These little joints that you have in the spine can radiate pain all the way to the foot. So people say, I have a pinched nerve.
Yeah.
Actually, they may be dealing with arthritis in one of these joints.
Okay.
Very common. We can test these accurately, and we can treat them with a very safe procedure called radiofrequency ablation. And this actually is the machine here that we use for the radiofrequency procedure. And it involves, we have to test first and make sure we know the levels and we found the source of the pain.
Yeah.
But then we burn a little spot just outside of 3 of these joints. So we pick the ones that seem to need us. Sometimes we'll just do one joint, but often it's 2 together. So we'll burn a little spot just outside these joints.
Yeah.
Just by heating the tip of the needle about as hot as a cup of coffee. That's all, for 90 seconds.
Wow.
And that is able to interrupt that nerve, and then you don't feel that little joint for several months at a time.
That's great.
That's something that's such a common problem. I actually do 4 of the burn procedures every day that I'm in the office.
Wow.
So that's probably the most common treatment that we do now. I do more of those than I do epidural steroid injections. Which is a lot of places that have pain treatment programs, all they do are epidural steroid injections.
Yeah.
But we actually do more of the ablations. But this is actually being studied to take the place of ablations. And another good application for the radiofrequency ablation is for knee pain. You can burn nerves in 3 places. Someone has had a total knee replacement. You actually can get rid of half of that pain or more in a pretty high percentage of those patients.
Wow.
So I do a lot of those ablations for people with chronic knee pain where surgery can't be helpful. But there again, this little device is being studied for going higher up into the thigh and stimulating nerves that go to the knee for people with who've had stump pain from amputation, or they've had a knee replacement and they have terrible knee pain and nothing seems to get to it. Surgery won't help. Then these can be placed around the major nerves, stimulate that area directly, and get a more powerful result typically than you would with spinal cord stimulation.
What are some other treatments, things, new technologies, things that you're doing here that you want more in our community to know that is available here, that they don't need to go to Knoxville?
Well, that's there are a lot of things, but I would say if I'm going to discuss one other thing, it would be the field of regenerative medicine, which is a new field in medicine. A lot of people have heard of PRP, that's platelet-rich plasma. We do that here. We're set up to do the stem cell treatments here. Regenerative medicine is a very exciting new field of medicine, and it's huge. encompasses everything that stimulates your body to heal itself. And you use natural products, whether that's your own platelets or your own stem cells, or sometimes some of the growth factors can be, there are different companies looking into producing growth factors in a way that they can be put into the body.
Okay.
But simply stated, platelets and stem cells both speed the healing process naturally.
Okay.
That's what your body uses. When
Right.
you get a cut, the platelets go there and they stop the bleeding.
Yeah.
But they also kick in to cure, and they start making growth factors.
Yeah.
And those growth factors start the healing. So they stop the bleeding, start the healing. That's what your platelets are made to do.
Yeah.
So we can concentrate those, and we do that right here. I think our centrifuge is back in the corner there.
Yeah.
And we can specifically place those in areas of typically a chronic pain problem.
Okay.
And really right now, if people look into that, you'll see research all over the place, and that's because it's new, and that's because everybody has a different way of doing things. And some of the papers are actually very poor technique. But it appears that the research centers that are doing a lot of stem cells and PRP treatment for pain problems, tendons, ligaments, small joints, this seems to be where the biggest group of patients would be right now. So tennis elbow, the ligaments around the knee, tendons around the knee or the foot, hand, all that can respond very well to PRP.
Okay. That's exciting.
They're using it for facial restoration, hair, thickening, all of that. There's probably it's been used for almost anything that you can imagine in medicine. They're looking into that. But one of the things that we won't be doing, but is exciting about this field, is they're learning how to get your cells to make you healthy. And one offshoot of that is they're able to make tissue, simple tissue now.
Yeah.
But I think it won't be long before we see organs made from your own cells.
Yeah.
So they could take their own cells and they could end up making an organ. Now, we're not there yet.
Right.
But they can actually make simple tissue already from your own cells.
Yeah. That's
So
exciting.
it's a very interesting field that
Yeah.
I've been studying for the last several years.
Yeah. Anything else that you want to let our viewers know today about you and your clinic and what you offer here?
Well, a lot of it we covered the last time, but we try to stay state of the art.
Yeah.
And one thing I guess to mention, 30 years ago, and I've been doing this for a little over 30 years, 33 I believe, since I started my practice in Knoxville, and I was immediately made director of the pain program at Baptist Hospital downtown in Knoxville. I was one of the first in Knoxville to use this CR, fluoroscopy, for doing a lot of the procedures that now are commonly used.
Yeah.
But at that time, I was the only one at our hospital. There was not an anesthesiologist at any major hospital in Knoxville doing some of the basic procedures, sympathetic blocks and things. So 30 years ago, this was a huge transformative tool that allowed us to do things we couldn't do before.
Yeah.
Okay, and now it's this. Ultrasound is the biggest thing to come along since fluoroscopy, in my opinion. It's the biggest thing in the last 30 years. It's changing the field.
Yeah.
And pain medicine physicians that were trained more than 5 or 6 years ago don't know how to use one of these. It's taken a lot of going back, and I go to meetings almost every month. Next month, it'll be about 6 this year that I go to specifically for ultrasound.
Yeah.
But as a tool for evaluation and treatment, it's absolutely amazing.
Yeah.
And there's no way to put this thing on the ulnar nerve or the radial nerve or the sciatic nerve without this.
Yeah.
You've got to be able to see that nerve very clearly. You have to be able to see this being applied through the tool that we use for this. And so it's a pretty steep learning curve, but everyone who's being trained now in sports medicine, interventional pain medicine, they're all using these tools. We have 3 of these. We have 2 ultrasound units here to help us with patients. So I would have to say that that's one of the biggest things to know, is that you should pick a pain doctor that really tries to make an accurate diagnosis and has the tools available to do that.
Yes, and I love that. And so yes, we want to thank you for letting us be here again for our Wellness Wednesday. Again, guys, if you're having that chronic pain, try to get in and see Dr. Harris before it gets too long or too late. Let him get you a good evaluation, really see what's going on, and try and deal with it versus just getting on the pain meds and just trying to live through it, but getting to the root of the issue. So again, thank you.
Thank you.
We hope you guys have a great Wellness Wednesday.